All right, today we're jumping into a surgical procedure that is just mind-blowingly complex, but also incredibly life-saving. We're talking about the radical cystectomy. So let's just stop and think about this for a second. How on earth do surgeons take out an entire organ, the bladder, and then from the inside just rebuild the whole system? It honestly sounds like something out of a sci-fi movie, right? But for patients with bladder cancer, this is very real. And yeah, that probably sounds pretty intense, but the first thing you need to know, and this is something the research makes really clear, is that the modern version of this surgery is actually incredibly safe. And even better, it leads to a really good quality of life. So let's get into the nuts and bolts of how it all works. So, where does this all start? Well, for the patient, it begins with a diagnosis. A diagnosis that puts them at a crossroads, where this major operation becomes the absolute best path forward. The diagnosis we're talking about is something called muscle-invasive bladder cancer. And what's so important here is that specific layer it's pointing to, the muscularis propria. You see, when cancer cells push their way into that deep muscle wall, well, that's a total game changer. It means things have gotten serious, and it's time for aggressive treatment because the danger of that cancer spreading just shot way, way up. Okay, so when do doctors say, all right, it's time for a radical cystectomy? Well, there are a few key scenarios. The biggest one, of course, is that muscle invasion we just mentioned. But it's also the go-to option when other less invasive treatments haven't worked on more superficial tumors. Or, if the cancer itself is just really aggressive. And here's the crucial part. This surgery is most effective when there's no sign the cancer has already escaped to distant organs. This brings up a huge question, right? Why go for such a major surgery when there are other options like chemo and radiation? Well, the answer? It's all in the numbers. Let's take a look. And boom, here's why it's considered the gold standard. I mean, just look at these 5-year survival rates. If you go with radiation or chemo alone, you're looking at a 25% chance. Combine them, and you can get up to 48%, which is better, for sure. But look at this. For cancer that's still contained in the bladder, a radical cystectomy jumps that survival rate all the way up to 75%. The data really tells the whole story here. All right, so the decision's been made, the numbers are clear, so what actually happens? Let's head into the operating room and break down how this incredible procedure really goes down. To tackle something this complex, surgeons break it down into 4 main phases. First up is just preparation and getting everything exposed. Second, and this part is so important, is clearing out the area, what's called a lymphodectomy. Third, they have to carefully free the bladders from everything it's attached to. And then finally, the main event, taking it out. It's this step-by-step approach that makes the whole thing possible. So let's zoom in on that second phase, the lymphadenectomy. The best way to think about it is like you're gardening. Imagine the bladder is a plant that's gotten sick. Well, the lymph nodes are like the soil all around it, and you have to worry that maybe some seeds of the cancer have spread into that soil. So surgeons have to carefully clear out that soil. And what you're seeing right here is just how precise this work is. They find key landmarks, like this obturator nerve, so they can be absolutely sure they're only taking what needs to go while protecting everything else. This diagram here, it shows you the goal perfectly. See all that fibrolymphatic tissue? That's our soil, and it's being meticulously stripped away from the major arteries and veins. The surgeon is literally skeletonizing these blood vessels, getting them completely clean. Honestly, getting this step right is a huge reason why the surgery is so successful. Okay, so the soil is cleared. Now it's time for phase 3, freeing the bladder itself. What this image shows is the surgeon creating a space, they call it developing a plane, right between the bladder and the rectum. And this is incredibly delicate work. I mean, these two organs are right next to each other. They're carefully separating them to isolate the bladder from the back. And that brings us to the final step in the removal process, the very last connections. A few ligaments at the front and the urethra down at the bottom are severed. And just like that, the bladder is free. It's removed from the body along with the prostate and seminal vesicles in men. The diseased organ is officially out. But wait, getting the problem out is really only half the story. Now comes what I think is the most amazing part of this whole thing, the reconstruction. How do you rebuild what you just took out? And there it is, the whole specimen, removed in one piece. This is our before. The cancer is gone. But now you have a huge problem to solve. Where does the urine go now? How do you restore that basic function? The answer is just
It's surgical brilliance. It's a technique called orthotopic bladder substitution. Get this. Surgeons take a small segment of the patient's own intestine, they actually refashion it into a little sphere to act as a new reservoir, and then they put it right back where the original bladder used to be. This new bladder, or neobladder, means that a lot of patients can urinate totally normally through the urethra. It's a massive leap forward for quality of life.
And right here, this is that moment of hope. This is the after starting to happen. You can see the urethral stump, that's the exit point, being prepared with sutures. That's the exact spot where the new neobladder will be connected. They are building a brand new, completely internal urinary system. It's just incredible, literally rebuilding the body from the inside out.
Okay, so the surgery's over, the reconstruction is complete. It's an amazing feat of medicine. But what does it all mean for the patient? What does life look like after all this? What are the outcomes? First off, let's talk about safety. The mortality rate within 90 days of the surgery is just 2.3%. Now, think about the scale of this operation. Removing an organ, rebuilding the system, 2.3% is an astoundingly low number. It's a huge credit to how far surgical techniques and aftercare have come.
Okay, so it's safe, but is it effective? You bet. For patients where the cancer is still contained inside the bladder, the 5-year survival rate is 75%. Let that sink in. 3 out of every 4 patients are, for all intents and purposes, cured by this single surgery. That is a powerful, powerful message of hope. But you might be wondering, what about those tougher cases? What if the cancer has gotten into that soil, those lymph nodes we talked about? Well, even then, this surgery offers a huge advantage. Up to 43% of those patients are still cancer-free 5 years later. It just goes to show you how critical that careful, meticulous lymph node removal really is. And this really brings everything full circle, doesn't it? It's not just about surviving, which is amazing in itself. It's about being able to live well afterwards. These incredible innovations, like the neobladder, mean that so many patients get to go back to a normal life with very few functional changes. It's all about restoring that quality of life. So that leaves us with a final question to ponder. When you have a surgery that's this effective and reconstruction techniques that are this advanced, where do we go from here? What's the next frontier? Is it going to be better chemo that can shrink tumors before the operation? Or maybe some kind of targeted therapy that makes this surgery even more of a home run? One thing's for sure, the incredible success of the radical cystectomy has set a very, very high bar for the future of bladder cancer treatment.